How do you administer antibiotics for childhood infections? When it comes to administering antibiotics for childhood infections, there are several important factors to consider. First, it is essential to identify the type of infection, the child's age, and their overall health. Most childhood bacterial infections respond well to oral antibiotics, which are easier to give and less invasive. However, in some cases, intravenous administration may be necessary, especially for very young children or those with complicated infections. Oral antibiotics are the go-to choice for most uncomplicated infections. They are effective and simple to administer. For children under 2 to 3 months old, or those who cannot take oral medications, intravenous antibiotics might be required. After starting treatment with intravenous antibiotics, children often switch to oral medications once they show signs of improvement, usually within a couple of days. Dosing is another critical aspect. Antibiotics are typically dosed based on the child's weight and the specific infection being treated. For example, beta-lactam antibiotics, such as penicillins and cephalosporins, are commonly used in children. These requiring careful scheduling to keep drug levels effective. This often means giving doses multiple times a day. Some infections, like urinary tract infections, may only need a short course of treatment, while others, especially in younger children, may requiring a longer duration. For instance, uncomplicated urinary tract infections in children over 2 years old can be treated with cephalexin, which is given about 3 times a day for 3 to 5 days. Alternatives like cefixime or trimethoprim sulfamethoxazole can also be used, but it is essential to be aware of resistance patterns in your area. If a child has a severe allergy to penicillin, alternative antibiotics must be chosen carefully to avoid cross-reactivity. Monitoring the child during treatment is vital. Completing the entire course of antibiotics as prescribed helps prevent antibiotic resistance and ensures the infection is fully cleared. Parents should be informed about the correct dosing schedule and watch for any side effects. In uncomplicated cases, laboratory tests are usually not necessary to guide treatment. It is crucial to follow clinical guidelines and be aware of local resistance patterns when using antibiotics. Avoid giving antibiotics for infections that are likely viral, as this can contribute to resistance. Always consult healthcare professionals for personalized medical advice regarding diagnosis and treatment. In summary, administering antibiotics for childhood infections involves selecting the right antibiotic and route, dosing based on weight and infection type, and ensuring adherence to treatment while monitoring safety. This careful approach helps effectively manage bacterial infections in children while minimizing risks.